Hello, my name is Margherita Nosadini. I'm a pediatric neurologist. Our paper in the November 2016 issue of Developmental Medicine and Child Neurology is a retrospective study on the use of intravenous immunoglobulin in pediatric neuroimmunology. IVIG is an expensive treatment used in immunodeficiency and autoimmune conditions. Increased demand and consequent product shortages result in the need for IVIG use to conform to guidelines. To review the current clinical practice on IVIG use in pediatric neuroimmunology, I retrospectively studied with Professor Russell Dale a cohort of 196 patients who received IVIG for neuroimmunological conditions at the Children's Hospital at Westmead, Sydney, Australia, between 2000 and 2014. Our study showed that IVIG is an expensive treatment with over $2.5 million spent in the total cohort for the whole study period. But it was relatively well tolerated, with only 2% of the patients experiencing severe or medically significant adverse reactions, mostly aseptic meningitis. The overall outcome was good, with about 2/3 of the patients having MRS between 0 and 2 at last follow-up. Although we observed that some conditions that had highest median cost per patient for IVIG had also poor outcomes, such as Rasmussen's encephalitis and immune-mediated epilepsies, suggesting the need for setting clear outcome targets when treating these patients. We also compared the indications for IVIG use in our cohort with the recommendations given in the most recent available international guidelines on IVIG use. And we observed that about half of the patients in our cohort received IVIG for indications that are defined as weak, or not recommended, or not even listed in the most recent available guidelines. Among the indications that are not listed in the guidelines are also some conditions that are frequently treated with IVIG in current clinical practice, such as transverse myelitis and anti-NMDA receptor encephalitis. Therefore, our study discloses discrepancies between guidelines and current clinical practice, suggesting both the need for greater adherence to recommendations and for recommendations to be updated to accommodate emerging indications.